You know, there are a lot of concerned parents out there, and we absolutely hear you. COVID-19 cases in children have been rising, and some hospitals are reaching max capacity. And parents with children of compromised immune systems are now making some really tough choices. New at 11, Paulo Soro spoke with a mom whose asthmatic son went to the hospital last week after a cough and it developed into trouble breathing.
Before the pandemic, hospital visits were routine for 6-year-old Hansel.
When he was in pre-K, he missed 100 days of school because he was in the hospital seeing doctors, sick.
The first grader is asthmatic.
A cold for him can turn into pneumonia.
His mom, Veronica, credits mask wearing and social distancing for why he's managed to not get sick the past year. That's until school started. Last week, he spent 4 long days in the hospital.
I was scared. You know, my baby's pale, he can't breathe, he can't talk. They're giving him treatment after treatment, and the treatments aren't helping. So I didn't know what it was.
When he tested negative for COVID-19, it brought up more questions than answers.
At that moment, I'm thinking maybe it's pneumonia. But what did the pneumonia come from? Is it not COVID? He's not showing any other symptoms.
Doctors told Veronica it was the rhinovirus, the most prevalent cause of the common cold. He was sent home Saturday and still has to take breathing treatments every 4 hours for 30 days.
Let moms know that they are not alone.
So how can you differentiate COVID-19 from a cold or allergies? According to the Mayo Clinic, allergies and a cold won't give you nausea, diarrhea, and you won't vomit, whereas those are all possible with COVID-19. Allergies also won't give you a fever, while COVID-19 usually does. And doctors say getting a COVID-19 test is always the best way to check and see, especially during flu season, where both viruses have very similar symptoms.
This situation this time was brought on so quick. I never seen this coming.
You know, right now we're starting to see a drop in COVID-19 cases among school-age children. So for the past month here, folks, kids 10 to 17 years old had the highest number of new cases, but over the course of the past week, those numbers started to fall. They're starting to fall. So now young adults between 18 and 29 are leading the way for the most new cases.